There is a new way to do away with double chins this morning. The FDA on Wednesday approved a first-of-its-kind non-surgical treatment designed to melt the fat off. Our Dr. Holly Phillips is with us and joins us at the table. Listen, I got a little squeamish looking at the video, but a lot of people are going to pay attention to what you have to say. How does it work?
Sure, absolutely. So it targets the double chin, or as my friend calls it, the enemy of a good selfie.
That's good.
The drug itself is called Kybella. It is a synthetic form of a compound naturally found in our intestine. Now, in our intestine, it helps our bodies to break down fat in food. In this case, it's being injected into the chin to break down fat in that area. It dissolves the cell membrane around fat cells, essentially causing them to burst and destroying them in the process.
And what happens to them then?
Yeah.
Right. So your body basically absorbs them and metabolizes them. I do have to say this is a big commitment. The procedure is done over the course of 6 months, a series of injections once a month, sometimes up to 50 injections at a time. It's not for the faint of heart.
And it's permanent,
That sounds
right?
like it hurts.
Right. Yeah.
Changed your mind,
Yes,
have
I'm
you?
thinking, well, double chin is not my issue. I'm more worried about a muffin top and cottage cheese thighs. Does it work on that?
Okay, but
Right.
But does it work on that?
We'll get to that. You know what? Actually, no. So if it sounds too good to be true, the idea of a safe, FDA-approved fat-melting procedure, in some ways it is too good to be true. It's only approved for this area under the chin. It is not recommended to be used anywhere else. We don't know if it's safe. But, you know, in terms of whether or not it's permanent, Nora, I spoke yesterday with one of the doctors who helped to conduct the clinical trials. He said, unlike Botox and Restylane that wear off after time, this actually destroys cells. So for his patients, 2 years later, the results were just the same. It seems permanent.
How much will it cost?
The company themselves, they haven't set the price. They say it will be available this year, but we can be sure insurance won't cover it.
And side effects, you might not be able to swallow, but other than that,
Well, you know,
it's okay.
redness, swelling,
Yeah.
yes, and other side effects.
Okay, all right. Dr. Holly Phillips, what's wrong with a double chin? Thank you.